Hello everyone and welcome to AceOSCE's video for today. Thanks for joining me, Alicia, and this is part 2 of the Pharmacokinetics series of videos that I'm putting out for you guys. This is again an overview of the second step of the pharmacokinetics, so hopefully this helps you guys out. This is part 2, absorption. Again, just an overview, a huge topic again, but hoping that this video gives clarity on the basics of this process. Absorption usually refers to the process of drug traveling from the drug dosage form into the systemic circulation. A few factors can affect it, such as the drug dosage form. So if it's IV, of course it will go into the drug circulation right away. If it is PO, it probably won't, so it has to go through a lot of more processes. The drug solubility is the second factor. So the more lipid soluble a drug is, it's usually more easily absorbed by the cell membranes, which is why usually these medications have a higher solubility as well as higher absorptibility rate. The third would be the degree of ionization. So the more ionized a medication becomes in a certain environment in your body, the less it is usually absorbed. Again, there would be exceptions for this. All drugs are usually only absorbed as a liquid, so if we ever give solid drug dosage forms such as tablets or capsules, they need to be formulated in a way that they can be liberated and dissolved into the body and therefore be absorbed through absorption membranes easily as a liquid. The different processes of drug absorption, or the different methods through which a medication can be absorbed in the body, are as follows. The first is passive, which is the easiest method. It just goes towards the concentration gradient. So low concentration drug to a high concentration drug levels. It usually happens when medications are highly lipophilic and non-ionized, taking place usually in the small intestines. The second is facilitated passive, where a carrier molecule on the cell membrane of the cell facilitates cross-membrane transport by a reversible combination, so makes a reversible complex with the drug molecule and releases it inside the cell itself. For example, glucose. This again goes across the concentration gradient with no energy expenditure needed. Active form usually needs energy expenditure. It goes against the concentration gradient, so takes the drug from a high to a lower concentration. It again has usually a cell receptor on the cell membrane that helps to formulate this, and it is usually absorbed from specific sites in the small intestines, for example ions, sugars, or amino acids. The fourth and the most less used one is pinocytosis, where the drug particles are engulfed by a small part of the cell membrane, encloses the drug particle, forms a vesicle around it and transports into the cell. Energy is usually needed, and this transport is again usually against the concentration gradient. This usually plays a small role in absorption of most medications, such as protein drugs. Again, any sort of transport that happens against the concentration gradient, so going from an area of higher drug concentration to a lower drug concentration, such as active and pinocytosis, usually need the expenditure of energy for this step to happen. So I'm just going to give you guys a quick diagrammatic view of this so you guys can easily understand it. If we consider area A to be an area of high drug concentration and B of low drug concentration, passive diffusion usually goes towards the concentration gradient and no energy is usually needed. So it's easy, just going from high to a low concentration gradient, again through the small intestines usually. Facilitated usually makes a reversible complex with some sort of cell receptor on the cell membrane. The drug particle makes this complex, goes towards the concentration gradient, does not need any energy expenditure, and the cell membrane rotates to release the drug inside. Within active, we go against the concentration gradient, so from low to high drug concentration. Again, there is usually some sort of complex that is formed on the cell surface. There is energy expenditure needed, and reversible complex formation is seen. In case of pinocytosis, the small drug particle is usually engulfed by a part of the cell itself. It becomes a part of the cell, and then the cell may rotate to release it inside the cell. Therefore, this absorption is against the concentration gradient and needs energy expenditure. Dosage forms, like we read, do influence absorption. In case of oral dosage forms, SL or sublingual or buccal are usually retained longer at the site of absorption, which is the mouth. Therefore, we see higher absorption of such medications. Most absorption from the oral system of taking medications usually happens in the small intestine, as this usually has a larger surface area for absorption and therefore highest absorption is seen here. GI flora as well as parasympathetic drugs, which usually affect gastric emptying, can affect drug absorption in this case. As we also revise that dissolution rate, or the amount of medication that can be available as a liquid form, usually is the amount that is absorbed into the body. Therefore, dissolution rate directly relates to the availability of a drug for absorption, especially for solids such as tablets and capsules. Therefore, solutions are usually easier absorbed than solids. In case of parenteral formulations, IV reaches the systemic circulation directly, whereas IM or SC need to clear barriers to be absorbed. In cases where the drug molecules are large, or specifically larger than 20,000 grams per mole, mole, given IM or SC, they must cross the membrane, and this usually decreases because the size of the medication is quite large, which is why usually such medications are exclusively absorbed through lymphatic circulation and are more prone to FPM or first pass metabolism, usually decreasing the bioavailability. Perfusion, which is the blood flow divided by the gram of tissue, or the blood flow rate or blood flow absorption, usually affects capillary absorption of IM or SC drugs. Injection site usually affects absorption rate, as we did see the difference between IV, IM and SC. Erratic absorption from parenteral formulations may also be a case which we need to consider, especially in shock or hypotensive conditions. For poorly soluble acids or bases, this may be another case, such as parenteral phenytoin. By giving them by different parenteral routes, this different absorption. Different dosage forms, such as the controlled release CR, SR or XL medications, these usually decrease dosing frequency and increase duration of effect. This results in decreased fluctuation in plasma drug concentrations, usually leading to decreased side effects and increasing in adherence. Absorption for these medications usually happens in the large intestines, and we ask you not to crush or split these tablets, as these are formulated to release over a specific period of time. In case of transdermal patches or transdermal drug delivery systems, these may release drug from the matrix slowly, maybe up to sometimes days, such as the Evra patch. Usually medications that have high skin penetration rates are the ones that are usually given out as transdermal, as the area of application is limited and we have to keep rotating usually the area of application. Therefore, it's only a few drugs that are usually available as this form. To extend the absorption, you can administer insoluble salt form of a drug, such as the IM form of penicillin G. And in order to tweak the delay of the absorption of a medication, coatings such as enteric coatings can be used for aspirin, like all of us know, so that the medication can be absorbed in a delayed manner and not right away when it goes into the stomach, for different reasons, sometimes compliance, sometimes side effect management. I wanted to give you guys a quick graph to compare the concentration versus time graphs of different forms of administration, such as IV, IM, SC and PO. As we can see, it is very easy for the IV drug to enter the circulation right away, which is why its concentration is highest at time 0 and it decreases with time. In comparison, IM, SC and PO usually have 0 concentrations at 0 time and slowly are absorbed into the circulation. IM usually achieves the highest concentration at a specific time for a specific medication. SC comes next, and PO usually has the lowest concentration if the same drug is given in different forms, just because it has to go through so many metabolism and distribution phases. So this is a quick comparison graph for you guys. Another important concept to keep in mind is bioavailability. It is usually defined as the extent and rate at which the active drug enters the systemic circulation. Again, factors that affect availability or absorption also affect bioavailability, such as drug solubility, drug dosage forms, etc. A couple of things I wanted to share with you in terms of the PEBC exams are definitions of equivalence. So usually medications are called chemically equivalent if they have the same chemical ingredient or the active ingredient. However, their excipients or their formulations may differ. Bioequivalent medications are all drug dosage forms that have the equal amount of plasma drug concentration as the tissue drug concentration with the same dosage regimen. So in case there's ever a question in the PEBC exams regarding this, you know what bioequivalent would mean. And therapeutic equivalence usually refers to all the drugs that give the same therapeutic and adverse effects to the same patient. Now, this is the concentration time graph of a drug. Any drug you can take, mostly PO drugs here. AUC or area under curve for the concentration time graph can give you the bioavailability of this medication. On the y-axis of the concentration axis, the highest point that the drug achieves is usually the peak plasma drug concentration, which usually takes place when the absorption rate of the drug equals the elimination rate. And the same point at the time graph is usually referred to Tmax, or the time of maximum drug concentration in the plasma or in the blood circulation. There are a few causes or factors that can decrease bioavailability of a medication, such as higher first pass metabolism, which usually happens for poor water solubility drugs, low time for absorption. If in case of gastric emptying drugs, they may reduce the time that the medication is in the stomach or in the intestines, which may reduce absorption. Chemical reactions, metabolism by microflora, and other factors such as age, sex, and gender also affect this. Another important concept is BQ, or blood-brain barrier. This is a barrier formed between the drug and the CNS. However, drugs may reach the central nervous system through the brain or the CSF, or the cerebrospinal fluid. Higher penetration is usually seen for drugs that are lipid soluble, such as thiopental. And from the CSF, or the cerebrospinal fluid, medications are usually absorbed to the brain by the choroid plexus, such as penicillins. Ionized or low water solubility drugs do not readily permeate BQ, or blood-brain barrier. Therefore, non-ionized and lipophilic drugs usually cross the blood-brain barrier easily. Usually these increase the bioavailability. So drugs that easily permeate the BQ usually have higher bioavailabilities than the others. The topic question for today would be: the area under the curve for drug A in its IV form on the concentration time graph is 480 units. For its oral form, the AUC comes out at 280 units. What is the bioavailability of drug A? The options are 28.3, 58.3, 68.5, or 35.6. Try to answer this question, guys, and if you have any question about answering this, definitely get back to me. Answering these questions and giving the reason for your answers helps you revise your concepts and leads others in understanding the concept as well. Again, this was an overview video, not going through too much. Wanted to give you guys a brush through the basics. Reach out to us, look us up at our website. A lot of you are asking me what we do and how we help our students, so definitely reach out to us on these platforms, and I'll be out in my next video shortly. I hope you have a great day for yourselves.